Okay, I believe we are live here on Facebook. So thank you to those of us joining live and after the fact. This is one of, I don't know actually what installment it is. I think we might be on our ninth installment of the Lunch and Learns that the Center for Pharmacy Practice Innovation has been doing here for the last little over a year now. So we appreciate your presence here today and are excited to get into this heart healthy talk. Just briefly before we jump in and I hand it over to our moderator and panelists, I do want to kind of share a little bit about why we are here and what we are doing. So the, I guess, premise of these sessions is to help you kind of, as the general public, understand what your pharmacist can help you with and how your pharmacist can answer questions about any like run-of-the-mill health questions you might have day to day. So yeah, that's the basic idea. And we're joined by pharmacist experts and other health professionals each time to help answer some of the questions you might have running around your head or you might not quite know how to verbalize. So with that, I will turn it over to Art and you can just give a brief introduction before tossing it to our panelists. Sound good?
Sure does, Madeline. Thank you. Today, we're going to focus on heart health and start with the heart. And we've got an excellent panel of specialists from a wide range of the healthcare area to help us make better decisions and understand from layman's terms about our heart. So with that, I'll start with Dr. Gibson, and we'll go on down the line with the rest of our panel.
Great, thank you. Yes, my name is Kate Gibson. I am a pharmacist here at VCU Health. I am also a faculty member in the College of Pharmacy. And my kind of area of focus has always been in cardiology. So I've done a lot of work on cardiology in the hospital, and I'm really excited to be here with you.
All right. And from the Department of Kinesiology and Health Sciences, we have Mr. Ryan Garten.
Thanks, Art. Yeah, my name is Ryan Garten. I'm an associate professor for the Department of Kinesiology and Health Sciences. My PhD is in exercise physiology, so I'm an exercise physiologist. And I did my postdoctoral research in a lab that focused on kind of identifying and mitigating the effect of heart disease and vascular disease in older adults and clinical populations. And while at VCU, my focus has been looking at negative lifestyle behaviors and how they impact heart health, specifically how mental health disorders can increase the risk of heart disease.
And thank you, Dr. Garten. And last but not least, we have from the Department of Internal Medicine, a dietitian who can help us all figure out how to eat a little bit better, Ms. Masa Fasad.
Thank you, Art. I work at VCU Health as a dietitian, as an outpatient dietitian. I used to work with a lot of chronic diseases, including the cardiovascular disease and diabetes. So I hope that I can be helpful in terms of nutrition and diet. Thank you.
All right, thank you. And whenever we get a group of people this smart together, we have to always remember that our audience are laymen. So let's explain things in a way so that somebody can explain it to their grandmother as they try to convince them to change their habits or their lifestyles. So with that, I'm going to kick it off with the first question that we have, and to put it in context, it's February. It's the month of love. It's Heart Health Month. It's the American Heart Month. So if you guys could help us understand just some of the simple ways that we could improve our heart health this month, some of the small things we could do to make that a little bit better, and maybe just talk about heart health just very generally to start us off? Oh, I'm just throwing that question out there generally.
I'll be happy to start off. So obviously from my background, the one thing that I know is fantastic for heart health is physical activity and exercise. So really just moving more, during the day. And we know that just doing even a little bit of that can be really, really beneficial. And so in my field, we collect a lot of data related to what you need to do to try to really get the most out of your heart, to stress it in some way to where you get some really good benefits. And some of those recommendations are very straightforward. We know that if or we put forth individuals to be physically active, to move 30 to 60 minutes per day, 3 to 5 days per week, has a substantial impact on heart health. And so it's really easy for us to kind of put those recommendations out there. But what I always tell people, because I counsel people on starting exercise all the time, is, and I think it relates well to American Heart Month, is when it comes to being active, you really need to find something that you love. And, COVID kind of pushed us out of the gyms and other things that maybe was easy for us to, or something that we like to do, but there's so many more opportunities out there to be physically active. So I think we're going to, once we actually come back into the gyms, I think we're starting to do that a little bit more. I always ask people to kind of go out and find something that you really, really enjoy. So if it is being at a gym and taking a class or working out on your own, or if it's more recreation based, something that I enjoy, being outside, walking, running, riding my bike, or even community based, where you're doing some activity with people that you really, really love, because sometimes exercise can be kind of a difficult thing to adhere. But knowing just even some of the minimums, if individuals go out and you move and you go for a walk 30 minutes a day for 3 days per week, we know that reduces the risk of heart disease by 10 to 20%. And we know that's a really substantial amount.
Could you touch on what some activities might be for somebody over 50, over 55, some of our older listeners and their family members?
Well, yeah, I think one of the activities that I love to do the most is just to walk around my community, or really between when I'm writing grants, other things like that, just getting up and moving around a little bit. Walking is something that I really enjoy. And it's something even I think sometimes we wonder that maybe just doing walking won't be as rigorous enough for us to kind of get some of the benefits. But if you're at the gym, you can have a workout program that is primarily just walking based, to where you just increase the grade, or you go out and you walk hills, to where you're getting a lot of benefit from both your heart and your blood vessels from doing something like that.
Thank you. So what are some of the other lifestyle changes that we could make? Ms. Fasad, could you touch on some of those things that you recommend to people?
Sure. I think the diet is one of the important components of heart health. Basically, I think we want to have a diet that we can manage our blood sugar levels, our blood pressure, and our weight. And also fats in our blood. So bad fats, we have the bad fats and good fats. Often you hear about the triglycerides and cholesterols and LDLs that need to be low and HDL to be high. So some of I think it's all about balance. I wouldn't say you're gonna have a low fat or low carb, because I know there are a lot of diets out there. But the first and the best thing everybody can do and start doing is avoiding as much as possible the processed food. So whatever is in the package and has a label, if we can avoid that as much as possible, I think brings us a lot of benefits in terms of lowering the sugar intake or refined carb intake. So, and as far as beverages, we can avoid sugary beverages, can avoid sweets and sugar in general, so added sugars. Packaged food, if we avoid it, we can avoid the bad fats, which you'll hear often, saturated and trans fats. So trans fats are normally in the bakery products, cookies, baked goods in general. Also, margarine is another one, and other shortenings. They can have a trans fat, which is, again, these are packaged foods. And also increase the, when you don't have a processed food, you increase fiber intake. So more fresh fruits and vegetables, more whole grains, more of the beans or nuts if you tolerate them, obviously, because they are hard. Sometimes for some people are hard to tolerate, but you want to have a colorful plate at each meal. So to include the vegetables and fruits, but mostly vegetables that have a vibrant colors, the green, dark green vegetables. It can be purple, it can be red, it can be yellow. So we want to include as much as visible for us a rainbow in our meals in our day. So the aim is 5 servings of vegetables and fruits. If we can do more, would be much better. Also another thing is including good fats. So good fats can be fish, could be nuts, olive oil, avocados. These are all good fats. So when I think it's much more beneficial to have good fats and avoid bad fats rather than just eliminate fat. Because I think fat is nutritious per se. We need fat because a lot of our cells are surrounded by fat. So if we don't have enough fat, that causes hormonal issues, for example. So I would say these are the dietary changes. The other thing might be sodium or salt. You hear often as far as the blood pressure goes. Something to consider, the people's response to sodium is very different. I think that's important to know for the physician and for the patient. But again, when you avoid processed foods, you're going to lower the sodium automatically if you don't add a lot of salt to your food. But you can always flavor the food with something other than salt. It can be herbs. So they have a lot of herbs. We have a lot of spices. You can use lime juice, lemon juice. They give a good flavor to the food. You can use seasonings if you like the mixed seasonings that doesn't include sodium. They are different types. One of them, probably the most famous one, is Mrs. Dash. If you buy the packaged food, you can try to look at the label or even the front of the packaging and look for, free sodium, free salt, very low salt, or low salt. The only thing to be careful is reduced salt claims or reduced sodium, because they still can contain high amount of sodium. It doesn't mean that they are lower than what is, it's a very low content. It just means that maybe from the 1,000, it was reduced to 500 milligrams. So that is still a high content. These are some of the recommendations that I have. Thank you.
Thank you. Is there any way that that I should talk to my doctor about my diet? Any specific questions I should ask them about my diet in relation to heart health that you might think of?
Well, I think it depends honestly on the doctor and their knowledge about nutrition. I think would be nice if you get the permission from your doctor and ask them if you can, explain to them what you eat, and they can kind of let you know if there is something that you can change. I think a very good habit, if you can do that, because most of the patients don't like to do that, is to record what you had for a day, 2 or 3, but even a day, just because that gives you and the doctor a visual. So when you see it and the doctor says it's much more, he or she can give you a much more accurate opinion about what can be changed in your diet. And if not, they can always refer you to a dietitian, and the dietitian can help you. But I think it's important to write down and look at it. It's scary, it's very tedious, but it's a very helpful tool for a healthcare provider and for you to see and decide.
Thank you. Dr. Gibson?
Yeah, sure. So, you know, from a pharmacist perspective, I really just have to endorse what has already been said by our other panelists. The best things that we can really do to keep our heart healthy is, you know, exercise, make good diet decisions, have good lifestyle decisions. And our medications are really meant to work kind of on top of those things. So they're very much meant to be a part of a heart healthy lifestyle. I think speaking specifically about medications, you know, some recommendations that I would make is we have a lot of really great medications in the cardiology space. A number of you may be on some of these medications. They only work if we can remember to take them. And I know that that is very challenging. I have a very hard time remembering to take medications when I have to be on them. But finding a way to help you remember to take your medications would be my first recommendation. If you struggle with missing doses sometimes, thinking about things like maybe getting a pill box or setting an alarm on your phone, or pairing your medications with some activity you do every day. Maybe every time I brush my teeth, I will remember to take my morning medications. And these memory tricks can kind of help you make sure you stay on top of taking them. Just sort of in general, heart healthy, but also just healthy in general. I would also encourage everybody to, as much as they can, fill all of their prescriptions at the same pharmacy. And that way your pharmacist can keep a close eye on all of your medications. They can make sure that you don't have any drug interactions or anything that we need to be concerned about and watching out for. You know, sometimes we all see so many different doctors and sometimes we fill at so many different pharmacies. We don't want these potential interactions to fall through the cracks. And so one of the best things you can do is to fill at the same place every time. And then I know when we do pick up our medications, we're often in a hurry. We're just trying to get in and out, but certainly take your pharmacist up on that offer to go over your medications with you. We are drug experts. We go to school for a very long time to learn about these medications, and we would love to talk to you about them. Sometimes there are just important little things, like some medications, you need to take them a certain time of the day, or you need to take them with food for them to be absorbed well. So make sure that anytime you pick up a new prescription or anytime you want a refresher on something you've been taking for a while, speak to your pharmacist. That's our job. We would love to talk to you about your medications and making sure that you're getting the most out of them as possible and taking them as safely as possible.
Thank you. How often should someone review their meds if they've been on taking medicines for a while and you know, a year or two? Should they ask their doctor for a review every 6 months, a year, 2 years? How often, just in general?
Yeah, I mean, that's a good question. And I think it really depends on each patient and kind of how many medications they're taking and the different disease states that they have. But, you know, certainly at least once a year, making sure that we get a good look at our medications and making sure that they all still make sense, especially with the heart. Sometimes there are medications that we don't take forever. We take them maybe for a period of a year. So making sure that those things don't stick around longer than we need them, screening for drug interactions. So certainly I would make sure you're at least annually meeting with your provider to go over your medications. And that's another thing your pharmacist can do with you as well. They can go over your profile and kind of look at what you're taking and provide their thoughts about your medication regimen.
Real quick question. So let's say some of our audience has older parents or grandparents, and they're trying to persuade them to be a little bit more consistent in taking their meds. Any tricks of the trade you could recommend in that scenario?
I mean, I think the memory aids are best. And perhaps, one thing to consider is I am going to make sure that I take my medicine before I have my coffee. So that coffee is maybe a treat after you finish your medications or whatever it is, something that you're kind of pairing your medications with every day. It really depends on the medication, but there are some drugs in the cardiovascular space that if you miss even one dose, you're really setting yourself up for potentially having some pretty significant effects from that. And so I think just kind of understanding the magnitude of how important it is to take medications every single day consistently. And sometimes one missed dose can maybe feel like a little thing, but depending on that medication, it might not be a little thing. And so understanding how important they are.
All right, thank you for that. So let's move on. We've talked a little bit about some of the things that are good for our heart as we begin this journey down understanding heart health a little bit better. What are some of the things that maybe some of our audience have in their lifestyle that they might want to cut back on because it's not so good for their heart? I'll just throw that out there. Ms. Prasad, you want to start with maybe, you touched on it a bit with processed foods, I think.
They are a lot. So one of them is the diet, the bad diet. So if somebody eats very often outside, that can potentially contain a lot of like refined carbs or bad fats or high salt. Excessive drinking alcohol. It can be smoking, stress, poor sleep, physical inactivity, of course, as Ryan mentioned. These are some of the things. And another one to consider are the exposures to environmental toxins, because a big part of cardiovascular disease is inflammation. So whatever increases the inflammation in our body can put us at risk for cardiovascular disease. So all the stuff that I mentioned potentially increase that inflammation.
Thank you. That's very good. So I've seen a couple different studies or different articles, I should say, about how much I can drink before I border on not being healthy. I've seen that wine's healthy for my heart. I've seen that wine's not healthy for my heart. Any insight on that?
As far as alcohol goes, the guideline is 1 serving for women and 2 servings for men a day, I'm sorry. That means 1 bottle of beer. So the serving is 1 bottle of beer, 6 ounces of wine, and 1 ounce of liquor. And that goes daily. So if I can't say, okay, one day I'm going to take 5, but the rest of the week I'm not going to take anything. That doesn't work this way because your liver needs to process that amount of alcohol in 1 day and can't process it. So of course that causes that inflammation that we are talking about. As far as wine goes, it's very hard to determine that. I think it's more of a, yes, I like wine, I want to drink it, because the resveratrol in the wine is the component that is helpful for the cardiovascular disease. But the amount of wine that you need to drink to get the amount of resveratrol that you need, it's going to be like 40 bottles. That doesn't work. So I don't think drinking wine necessarily helps your cardiovascular disease, but I think wine is included in a lot of cultures. European culture particularly has that, the red wine. And I wouldn't say, okay, you don't have to drink it if you want, but you want it to avoid excessive drinking. So, because I think culture and enjoying food also is important, because if you pressure ourselves to a diet that is causes of suffering, that just per se causes the stress, and that stress is not good.
All right, thank you. Dr. Garden, what are your thoughts on the lifestyles and habits that you might want to avoid in order to improve our heart health?
Well, I have one big one, and it was mentioned recently, just the physical inactivity, but specifically sitting, prolonged sitting. One of the big issues and one of the major research areas that I kind of came in with was examining this. So about 50% of our waking hours as American adults is spent in a sitting position. And that seems kind of like a really a large amount, which it is. But if you kind of think about how we started to have a shift in what our jobs look like, going from a few decades ago where you probably, if you're looking for an available job, it was likely you could get something in manual labor, but now it's usually going to be computer facing at a desk somewhere. So the service jobs have gone up to the point where sitting is kind of a part of our work life now, and that's problematic. So we know that sitting has pretty quickly starts to damage some of the blood vessels that we have in the lower limbs, and that can put additional strain on the heart. And so some of our studies were pretty extreme sitting, where people wouldn't move their legs, they wouldn't fidget at all. But we saw some pretty quick and pretty interesting things related to putting additional strain and work on the heart. And so I think really anything you can do to kind of reduce the amount of sitting that you have in a day, I think it's always good. We promote exercise, but we also say to be physically active, meaning, exercise is a structured thing. You're going to go out for 30 minutes and you're going to do something like running or biking or whatever. But physical activity could be anything. It could be walking to and from work. It could be being out in the garden. It could be just really the activities that you do. And if you spend the majority of them in a seated position, obviously it increases the risk for heart disease substantially. But silver lining, luckily, some of the research has come out from my group and some other groups have shown that, even 30 minutes of exercise before like a prolonged sitting bout of 3 hours was enough to kind of protect against some of that reduction in blood vessel health. And intermittently getting up every, say, hour and just walking for 10 minutes was good, as well as, people would sit for a long time and then do something afterwards. So if individuals are in a position to where they, are sitting for work or just sitting a lot, and they notice that, you're just breaking that up a little bit or doing some exercise and physical activity before and after is kind of critical at reducing that, because there was a study that recently came out that looked at the outcomes related to people that sat a lot and saw that that risk for heart disease and death was higher than what they had reported for smoking. So sometimes you'll see that sitting is the new smoking. I think we need some more research to kind of validate that, or some more interventional stuff. But I think that's just kind of showing how detrimental that prolonged sitting can be, and it being a big part of our work life now.
Yeah, I'll wait for the research before I get that bumper sticker. But so we've talked a little bit about what's good, some things to do that are good for your heart. We've talked about some things to do, some things to stop doing that are not good for your heart, in a wide range. But let's bring it home and talk a little bit about the general challenges that a lot of people have with their hearts, with their heart health. Whether it be, well, Dr. Gibson, I'll let you lead in from there.
Okay, so just kind of what are some of the most common things that patients have regarding heart health? Yeah, so definitely the most common is high blood pressure, or sometimes we call it hypertension, means the same thing. That's definitely one of the most common things that we see. In fact, almost half of Americans actually have high blood pressure. And so definitely something that we see quite a bit in clinics, see in the hospital. And high blood pressure can be really stressful on your heart over time. It can lead to other cardiovascular diseases. It can lead to kidney disease. So it's a really big one and a really important one to make sure that we're managing. I think high cholesterol is also something we see pretty commonly. A lot of patients are receiving treatment for high cholesterol. Again, we worry about the association that this has with other diseases, things like heart attacks and strokes. And so another big thing that we try to control. And of course, things like heart attacks and strokes and heart failure and atrial fibrillation, these are all probably diseases that most of you have heard of, all tend to be pretty common in the United States. So heart health is definitely a big one, very important for us here.
So some people don't understand the importance of monitoring their blood pressure, or the importance of or the danger of high blood pressure until it's way too late. Can you talk a little bit about why high blood pressure is not a good thing for your heart, and why they shouldn't wait? Because it's not a small thing.
Right. Yes. I agree. It is something that we need to catch early and that we need to manage early. And the reason is the longer you're living with high blood pressure and the longer that that is going on in your body, the more organs that high blood pressure is putting a strain on. And so, for example, high blood pressure over time can cause heart failure. And the reason is, if you think about your blood vessels and you think about the blood in them, if the pressure is very, very, very high in your blood vessels, and the heart's whole job is to keep that blood moving, that gets really hard if the pressure is too high, right? It's harder to push things. It's harder to push that blood forward. And so the heart gets very tired. It's trying very hard to pump and to push that blood along so that you can get oxygen to all of your organs and your tissues. But over time, it kind of wears the heart out, and that can result in heart failure. High blood pressure can also sort of wear the kidneys out over time and can lead to chronic kidney disease, which is really not so much reversible. And so you certainly want to get on top of the blood pressure early on so that we can prevent that from happening in your body. So it seems sometimes we're just looking at a number and it doesn't necessarily make sense why that is so detrimental, but a lot of silent things are kind of going on in your body. And so staying on top of your blood pressure as early as you can and being really good about your diet, your lifestyle, if you're on medications, in the long run will really benefit organs like your heart and your kidneys.
Thank you. Could you, so we've all just experienced something that we'll hopefully never experience again in our lifetime, which is a pandemic. Could you just briefly touch on how COVID-19 has impacted people's heart health, if at all?
Yeah, of course. So unfortunately, COVID really has impacted heart health. If we think back to like March of 2020, we were kind of watching cases in New York and we were like, oh, this is a disease of the lungs. And that's really kind of what we thought in the beginning was this is something that's really impacting the lungs. But what we've come to realize is that COVID is impacting organs all over the body, and one of them being the heart and cardiovascular health. Unfortunately, the way that the COVID virus gets into our lungs is through a specific protein, and we have that protein on other parts of our body too. And so we're certainly seeing COVID impacting the heart as well as our blood vessels. We're seeing patients who have had COVID be at a much higher risk for developing things like heart failure or blood clots or even arrhythmias than patients who have not had COVID. And sometimes we're even seeing this happen in like young patients who didn't really have necessarily other risk factors for heart disease. And so COVID alone is a risk factor. And so unfortunately, there's no like medication that can stop all of this from happening and stop it from, potentially hurting our heart and our blood vessels. So the best thing that we can do is just continue to take the pandemic very seriously, get vaccinated, get boosted, We're certainly seeing patients, in the hospital that didn't get a booster dose, but did get their initial vaccinations. And so making sure you stay on top of your boosters, wearing your mask, socially distancing, hand sanitizing, all of these things. I know we're all so tired of it, but in the long run, it's really important to continue to practice these things to kind of protect our heart and to protect our health in the long run.
All right, thank you. So this next question is for everyone on the panel, and we want to look at this next question from multiple perspectives. So a lot of people are looking for alternative health solutions that may be non-traditional Western solutions, such as more holistic health and more integrated health approaches. Any advice on that as far as relative to heart health and maybe how to talk to your physician about it or people on your health team about it, and some actions to take to make the right decisions? And that's a question for everybody. Jump in.
I mean, as far as the diet goes, I think probably the most common one is the use of nutritional supplements. There are a lot of supplements out there for cardiovascular disease. I think the best approach for nutrition supplements is following a healthcare professional advice. If you don't want to do that, at least when you go to your doctor or to your pharmacist, let them know that you are taking these supplements. It's very important, supplements or herbs. So it can be herbal supplements, or it can be vitamins, or it can be other types of supplements. There is always a potential for an interaction, and that can be sometimes really dangerous. So I wouldn't advise to get a supplement just because you read it online. Also because every type of supplement is good for specific issue, and there's always about the balance. Even if something as simple as vitamin C, sometimes if I take only vitamin C, I have other antioxidants in my body, and that throws off the balance of other antioxidants in my body. And that might be harmful. But the best advice is just to make sure you tell that, especially to the pharmacists, because I think they are the best. They are very knowledgeable about the interactions more than anything. I know of other integrative approaches. I think most of them, like yoga, meditation, qigong, tai chi. There are studies that they suggest that they improve the blood pressure, or they improve the respiratory rates. There's Reiki, there's studies about Reiki helping reducing anxiety and and improving emotional well-being. I think most of them are about reducing the stress, which is very important for the cardiovascular disease. I think those these type of therapies is very hard to do research on. It's very hard to find the good research and long-term research, but I don't think they hurt because again, they at least you don't take anything that interacts with your medications. The only thing I read, and might be in the common, might be a little bit common, is chelation therapy, which there is not much evidence about it. So if you do something like that, it would be beneficial to ask your practitioners about that. That's all I have to say.
All right, thank you. Dr. Gibson, I guess a similar subject to the supplements and the vitamins and the interactions. There's been a lot of new information coming out about low-dose aspirins and heart health. And could you talk a little bit about what the current guidelines are as opposed to what they were a few years ago?
Yeah, of course. So yes, aspirin is getting a lot of attention lately for sure in the press. And I think what you're referring to is there's been some new guidance from the US Preventative Service Task Force about the role of aspirin in primary prevention. And so what primary prevention means is in patients who do not already have atherosclerotic cardiovascular disease, which is another big word that basically means, things like coronary artery disease, heart attacks, strokes, peripheral arterial disease or PAD. So the new guidance is really for patients who don't yet have any of those diseases. And that's where things have changed lately is what we think the role of aspirin is in those patients. So I want to make that clear. There are patients that already have these diseases, and the role of aspirin in managing them is still there. It's still beneficial. If you have these diseases and you've been prescribed aspirin, nothing has really changed there. But we're really talking about folks who maybe pick up baby aspirin at the pharmacy because they heard it could be good for their heart health, but they haven't necessarily been told that they need to be on it for any specific reason. And so that's kind of where the guidelines have changed recently. This is based on back in 2018, there were 3 really big studies published, and they were looking at the role of aspirin for primary prevention. And what we realized was that aspirin, it's a blood thinner. And so we're always dealing with this delicate balance between its potential to prevent a cardiovascular event and its potential to make you bleed. It's always a fine line, right? And so these studies kind of helped us understand a little bit better when the benefits may outweigh the risks and when they may not. And so really what has changed is we're starting to realize it may not benefit everybody. It's not something that everybody should just be picking up and taking because it could potentially be good for your heart. And the reason is it can cause bleeding events, especially like GI bleeds, stomach bleeds. So the new guidelines basically say that there may be a role for patients who are between age 40 and 59 if they do have a high risk of atherosclerotic cardiovascular disease. So there's these calculations we can do. Your provider can do them for you. Your clinical pharmacist can do them for you. And they can basically tell you the percent chance of you having something like a heart attack or a stroke in the next 10 years. And so basically, if that risk is at least 10% and you're between 40 and 59, the new guidance says you may benefit from a baby aspirin, but certainly have that conversation with your doctor. Don't just make that decision on your own because there may be something about you that makes you higher risk for bleeding or something like that. This is a change. We used to maybe think aspirin benefited patients who were older than that for primary prevention. And now we're starting to wonder if maybe the risks of aspirin might outweigh the benefits as we age, because we're seeing that maybe more prone to bleeding and less prone to benefit from the drug. So that's been the big change. I will say not all cardio societies and guidelines even agree on aspirin and agree on exactly the best way to use it. And so it's certainly a conversation that you should have with your provider. Every patient is different. Every patient has a different set of circumstances, a different list of drugs that they're taking. But if you think that maybe it's something you might benefit from, I would have that conversation at your next appointment rather than just picking it up over the counter, because we know that it's like 29 million Americans, I think, just pick up aspirin over the counter, and a big percentage of them don't necessarily have a reason to be on it. So we certainly don't want you taking something that might make you have a stomach bleed if it's not actually going to benefit you. So that's an important conversation to have.
Are there any other supplements or commonly taken over-the-counter medications that you can think of that people should be mindful of as relates to heart health?
Yeah, I mean, I would definitely agree with what Ms. Prasad said about our supplements, in that we need to be really intentional about what we're taking, and make sure that there is a need to be on anything that we're taking. Things like multivitamins even have been studied extensively for cardiovascular health, trying to see if that might help you with heart health. And there's just no clear evidence that they are beneficial for heart health specifically. And so a lot of these things, they just seem so benign. They're just sitting there on the counter or on the shelves at the pharmacy, and we just pick them up because they sound healthy. But I agree with what's already been said. We need to be talking to our providers to make sure that they are a good choice for us, to make sure that we do have a need for them. And especially because they get expensive. So we don't need to be spending all our money on something that may not benefit us. So yeah, that's kind of, there's no clear evidence of things like vitamins and supplements specifically supporting heart health in just the general population.
So to everyone on the panel, this question is related to, as someone goes to talk to their doctor or talk to their pharmacist, and they don't really understand what medicines they're taking, or the impact of what medicines they're taking, why they're taking some of the things they're taking. Are there any specific questions that you can think about? Just a couple of powerful questions that they might be able to take to help them better understand and have a good dialogue with their doctor or pharmacist.
I can start with that. So when I talk to my patients about their heart medications, there are a few things I want to make sure they know. I, of course, want to make sure they know how to take their medication. So if there are any questions there, how many times a day do I take it with food? But I also want to make sure they know what disease it's treating and why it's important. And so by why it's important, I mean, what exactly is it doing? Is it reducing your risk of having a stroke or having a heart attack? Is it something that we know can make you live longer? I think it's really important to understand why we're on all of these things so that we can, stay motivated to take them and to really understand what they're there for. And I think if you have questions about these things, your pharmacist is a great resource. Again, this is what we're trained to do. We're trained to look at your medications, understand what they're for, understand how to use them as safely and effectively as possible, and to have these conversations with our patients. And so even just going through your drug list and saying, can you help me match all of these drugs to my diseases or my reasons why I'm on medications, and can you help me understand how I'm going to benefit from this? These are great questions to ask so that you can, really take charge of your own health and be an active participant in your own healthcare.
I think that's important, that we're all active participants in our own healthcare. Ms. Prasad, when I go to the store, when I go to the grocery store, I look at labels and things and see all of these things that I don't understand and have absolutely no clue about how they might impact my heart health. Any suggestions on how to better understand what the labels say and how it relates to my heart health?
Sure. I think label easy. I have here, I can share with you just a few tips if you're a starter. So this is the nutrition label. I think is the current for the foods in the US. There are three components. Now we talked about high blood pressure, elevated blood sugar levels, and the fats. So we have all three components on the label. So if we are looking for a low sodium or low salt food, we want to have this number less than 300 milligram. If we have the fats, we want to have the total fat less than 5 grams and the trans fat 0. I think more than that, the most important one is to not have the trans fat in the food. The carbohydrates, because I think one of the underlying diseases for cardiovascular disease can be high blood glucose, because again, high blood glucose causes a lot of inflammation in our body. So I think it's important to control and manage if you have diabetes or not, because we might be, a lot of times we are hearing now the pre-diabetes problem. So it's important to know the carbs. We always want to look at the dietary fiber. We want to make sure it's more than 3 grams. We want to add total sugars, or these are added sugars. We want to have this 0 if it's possible. If not, we want to make sure that it's less, the least it can be. The other thing we can look always are the ingredients. So ingredient list can be very confusing, because you have sometimes 10 or 20 ingredients in a food. I think best rule of thumb is if a food has more than 5 ingredients, probably it's better to not consider it because that is highly processed. The other would be you look at the first ingredient, because a lot of times the first ingredient on the foods is sugar. That indicates that that's probably not the best option. For trans fat, for example, you can always look for, does it say hydrogenated or partially hydrogenated oil? That means that it contains trans fat, because sometimes actually food contains the trans fat, because that trans fat 0, if the food contains 0.5 gram, it still is 0. So if we want to avoid it more than as much as possible, we want to just look at the ingredient list as well. I'm not sure if that's too complicated, but I try to put it as simple as possible.
Thank you. So we're getting close to the end of our time here. Any final thoughts from the panel on, from anyone on the panel on, to wrap up about heart health and how we can all be a little bit healthier and pay more attention to our cardiovascular systems?
I think it got mentioned briefly before, but I think stress is a really big one to consider as well. And that's something that my research has a lot of interest in. We look at individuals with PTSD and generalized anxiety disorder and see how it impacts their heart health. And we look at people that are really young, usually in their low 20s, and we see some sort of an impact. So I think, looking, or maybe it's when you're going to talk to your doctor, or, just doing a Google search to try to figure out, some stress reduction techniques, because we were generally pretty stressed before COVID, and we're a lot more stressed now. And I know I see that with our VCU students. They're very, very stressed. And there's a lot of really, and we were talking about the integrated health solutions, there's a lot of really good ways to reduce stress: mindfulness, meditation, yoga, which also exercise as well. We utilize both, weightlifting and aerobic exercise to try to kind of reduce stress. But it might be one of these questions too to bring up with a doctor regarding that, just because I think we're starting to really see that link between stress and heart disease more clearly than ever before. And it's something that in most cases, it's tough for us to get all the stress out of our life, right? But there are definitely some really, really good ways to kind of reduce that. So maybe it doesn't have as big an impact on our heart health.
All right, anyone else? Final thoughts on
I would
heart
just
health?
say, from my perspective, just take full advantage of how easy it is to access pharmacists when you have questions about your medications. You don't have to make an appointment. You don't have to have a copay. You can just come in if you have questions. and we can answer them for you. We can help you make sure you're using your medications as safely and effectively as possible, and make sure that you kind of understand what they're all for and how they're helping you. So don't forget that you have that resource at your fingertips anytime you may need it.
That's a great point. That's a great point. Thank you.
I'm just gonna say one of the diets that probably is studied for the cardiovascular disease is Mediterranean diet. So that is a good kind of pyramid that represents the diet. I think it's good to have that in mind. Start improving our diet. Again, as I mentioned, I think we start with the diet and then go to the supplements if it's necessary. We don't take supplements instead of the food. I think it's very important to consider that. And emotional well-being, as was mentioned, I think is very important for the diet and health of cardiovascular disease.
Yeah, that pyramid was very helpful. Unfortunately, I see some of my friends have that pyramid flipped a little bit in their eating, but it's always good to get a visual. Thank you. So with that, we're gonna wrap up our Start with the Heart session here. Thank you to our panel. And Madeline, I'll turn it back over to you.
Yes, thank you, Art, and thank you to all our panelists for joining us today and sharing your insights on kind of the different areas of our lives we can focus on heart health. It's a very, I think, overlooked topic because there's so many, I guess, easier things to kind of get our hands on in practical ways that we know of to tackle our health, but it was helpful to hear from y'all some of the practical and ways you might already be caring for your heart health and not even realize it. So I certainly learned quite a bit today and hope our audience did as well. Thank you as well to our audience for joining us. On that note, this is, I guess, the end of our February session, but we will be having another Lunch and Learn session in March, so be on the lookout for details for that. And with that, I hope everyone has a great weekend. Thank you all again. Bye.